So the first question we have is, I've heard about PGT, but I'm not sure if it's something that we should consider. Can you explain who's it for and whether it actually improves IVF success rates? PGT stands for pre-implantation genetic testing, and involves taking a sample of some of the cells from an embryo that are going to make up the placenta and sending them to a lab to get genetically tested. And this technique is sometimes used with people with a specific genetic disorder or who are at risk of passing a gene on to the next generation in order to try and reduce the risk of this happening. PGT-A stands specifically for pre-implantation genetic testing for aneuploidy. And aneuploidy is just another term for a chromosome abnormality. This is where the same technique is used to check that the embryo has the right number of chromosomes. And many embryos that patients produce won't have the right number of chromosomes, and that's often why embryos don't implant, or if they do implant, they result in an early miscarriage. Embryo quality is usually assessed by simply looking at an embryo, looking at how the cells look like, looking at how the embryo grows, and it really is a fact that you can't judge a book by its cover. Good-looking embryos may not be normal genetically. PGT-A allows patients to select out and only use embryos that are considered to be chromosomally normal. Whilst these won't implant 100% of the time, their implantation potential is better and they result in pregnancies with a lower risk of miscarriage. Whilst PGT-A won't make your treatment more likely to be successful, it does what we call reduce the burden of treatment. So it means that the time taken to achieve a successful pregnancy is likely to be shortened, and where you do become pregnant, the risk of miscarriage is likely to be less, particularly because most miscarriages are associated with chromosomal abnormalities.